Hello everyone, I'm Dr. Vismaya, Ayurvedic surgeon, Changampally. Today we have with us the Chief Physician and Ayurveda Oncology Specialist, Dr. Firdouse to have a discussion on her expert insights on cases of multiple myeloma. Welcome ma'am. Ma'am, multiple myeloma is the common blood cancer which we deal in our day-to-day practice. In your vast experience of dealing with patients of multiple myeloma, what is the approach you follow as an Ayurvedic physician?
In Ayurvedic point of view, it is a disease of both Rekta and bone. That is, we consider both these factors. We consider two dhatus. That is, it is a disease of plasma cells actually, not like the other blood cancers. It differs, like in the sense it is different. So we have to consider first the nourishment of the body. From the nourishing tissues, we consider the last point of this nourishment as blended inside the majja. Majja is not properly formed in such cases. That is the pathophysiology. If you explain it in Ayurvedic point, we have to explain many things. Ama should be explained and other things, dhatu, these should be explained in its pathophysiology. I think it is better not to go to that point, but let's consider the clinical approach, how it will be. I think you might have expect that thing, yes. When a case come to me first time, I check whether it is truly multiple myeloma or the any other cases. So for that I depend modern equipments like X-rays, everything will take, and the kappa lambda, everything will take, and blood pictures, everything will consider. Then give symptomatic relief first, because the patient's consideration is their pain, fatigue, and other difficulties. That has to address first. Then we will go to next step. And in that sense, kappa lambda I will take as the prognostic value, and within one bi-monthly or monthly checkup will do to check this. And usually patient comes to me like symptoms like pain. So first line of treatment, of course, to reduce pain. But which area is pain will be there, all body pain will be there, and most of the patient with excruciating pain. So the external application will give and internal medicines, but with consideration in mind about this plasma cells, blood cells, and bone cells. That is the consideration.
In patients with multiple myeloma, with the conventional treatment, stem cell transplantation is indicated. And in some patients, they are eligible for stem cell transplantation, and some others may not be eligible for it. From our point of view, whether the approach is different for eligible patients and ineligible patients in considering stem cell transplantation.
Okay, so when you say eligibility, what do you consider first?
See, if a patient is of old age or having any systemic illness, or if patient is not in a condition to accept the stem cell transplanted, then they are considered as ineligible.
Yes. In such cases, it is very important to treat the Ayurvedic physicians, such patients, because in such cases they have no other options. Most of such cases I have treated are above the age of 50. They may be having some cardiac issues or any other means. Most of the patients, their blood picture, hemoglobin may be very much impaired. So they could not give any other medicines for that. They might have tried all the aspects. In such cases, I took 2 weeks. 2 considerations are there. One is to make them eligible for stem cell transplant. If it is very effective for them, if that is the best choice for them, that depends the case of patient. In such cases, I give medicines to improve their blood pictures. I mean, this CBC, total blood count, and kappa lambda also consider, but that the reports means kappa lambda light chain difference may come within it may take 3 to 6 months in our treatment. So anyway, I consider this and I give some medicines to improve blood pictures, and of course pain management also will be there. And if I can make them eligible to this treatment, then I'll ask them which you prefer. If they prefer the stem cell transplant, I will think it is better to go for that. And if it is not in that stage, they can continue this treatment. Many patients are there. I am very satisfied to treat such patients because there are no other options. So in such cases, it is a very good option. But in eligible patients, in this way we can take both eligible to non-eligible patients, we can make them eligible. And if it is non-eligible, we can give like palliative care. Their symptoms will be subsided. Many patients are there. My experience with multiple myeloma is wonderful. Many cases are there. They have got very good results. In the sense of both symptomatic and curative.
Madam, is there any particular case which you can discuss today in multiple myeloma in which you got a satisfactory result?
Yes, many are coming in my mind, and I think my first experience with multiple myeloma was one of my friend's mother. That time she was 55 years old, and she came to me with excruciating pain, and she was diagnosed as multiple myeloma, and she was not ready to do any treatment because they have some financial issues, and she is not ready to do any treatment. And they thought that she is going to die within few months. So they approached me, and she asked me, as my doctor's friend, you just give me some thaila, in the sense oils. They think Ayurveda is something like or application of oil, and by that oil application she will reduce their pain, local pain may reduce with that. In that sense, she came to me and I treated her, and now after 15 years, she is alive with no kapalanga, light chain, everything is within normal. And she had been in that chain for many years, but now she is free from disease. I think it has taken more than 5 years to come down this kapalanga chain. Now she is better. And no other symptoms, nothing is there. She is healthy now, healthy grandmother.
Madam, in patients with very poor prognosis, in the last stages, what are the Ayurvedic modalities you follow, or whether we can take such cases?
We can take such cases because due to this pain, and many patients may experience constipation. It's due to this other medicines they are taking due to the painkillers in conventional treatment. So in such cases we can give palliative care. That is also very effective in multiple myeloma. I don't know why the multiple myeloma pain is reducing with some medicines. Exact reason I could not explain, but it is in my experience palliative care is better than in other cancers. In multiple myeloma, we can give medicines to reduce their bowel accumulation and others in the pain, tiredness, and fatigue, and this one food intake. Everything can be normalized with our medicines. That can be done.
So, in your opinion, my multiple myeloma patients, Ayurvedic treatment is very effective.
Yes, I think it's a boon for such patients. Means we have treated and we got results. That is really effective. Means many type of patients are, as you asked, if they are not eligible for other treatments, this will be the better option.
I hope this session was informative and useful to all our viewers. I thank our beloved Firdouse Madam for this session. Thank you so much.